Many of you may have felt depressed before. A bad breakup, maybe the loss of a loved one, or sometimes there is no reason. These feelings usually pass on their own. Other times, they can last a very long time and be pretty severe. That's when you need to get a doctor involved. The number of people on antidepressants raised from a monthly rate of 2,575.9 in 2016 to 4,284.8 in the present day. That is a 66% rise. The first line of treatment is typically SSRIs, or selective serotonin reuptake inhibitors. These can often have some unfavorable side effects. So, what if there was a medication that helped with depression but didn't have as many side effects? Well, there is. Next. So, why Wellbutrin? The use of Wellbutrin in patients with depression helps lessen the side effects they have to experience, provides a more tailored approach to dosing for each individual patient, and brings up opportunities for augmentation treatment. On the right-hand side, you will see my agenda of talking points. So, what makes me qualified to talk about this? Well, I myself have been taking Wellbutrin for a very long time, and when I say it has changed my life, I mean it. So hopefully I can bring opportunities for you guys to understand the medications that your doctors might not be telling you about and help advocate for yourself. Next. The side effects of SSRIs, SNRIs, serotonin norepinephrine reuptake inhibitors, and TCAs, tricyclic antidepressants, are all often the same. One of the most common side effects being weight gain. All SSRIs have weight gain associated with them. There's an estimated 65.3% of occurrence. Another symptom is loss of libido or sexual dysfunction. This is estimated to be 30 to 70% occurrences. This can be especially troubling if you have a partner. There's also drowsiness, which can make driving dangerous and it being difficult to stay awake doing day-to-day activities. On the right-hand side, you can see a graph that depicts the most common to least common symptoms of antidepressants. Next. On the other hand, Wellbutrin is not associated with any kind of weight gain. In fact, it is associated more with weight loss. 15% of patients lose more than 5 pounds, and 6% of patients lose more than 10 pounds. If a person does not lose weight from the medication, they likely won't gain weight from the medication either, meaning it's typically weight neutral. Additionally, it can help increase the energy due to the increased norepinephrine, since Wellbutrin is a norepinephrine dopamine reuptake inhibitor, also known as an NDRI. It also can higher a person's libido due to the increase in dopamine. On the right-hand side, you can see a graph that depicts the experiences patients feel when taking Wellbutrin in reference to their side effects. Next. It is important to know the benefits and limitations of the medications you are planning on taking, as it can be a deal breaker. Next. SSRIs, SNRIs, and TCAs, as we talked about, have some similar side effects. However, there are some important differences. SNRIs have more severe withdrawal effects. These present in physical and psychological symptoms. Physically, you may feel sick, be shivering, and have cold-like symptoms. Psychologically, you may have nightmares, crying episodes that last weeks to months. An example of this would be the drug Effexor, which has often been named side Effexor, since if you miss one dose, you typically end up feeling nauseous, sweaty, and having nightmares. TCAs, on the other hand, such as doxepin, can cause severe confusion and drowsiness. This is because some TCAs are used as sleeping aids for those with insomnia. Next. Wellbutrin's benefits is that they have a variety of dosing options. There are 3 different types of doses: SR, IR, and XR. SR is sustained release. It goes on a 12-hour period, so you take it twice a day, one in the morning, one at night. IR, immediate release, has a 6 to 8 hour period, meaning you take it 3 times a day. XR is extended release, meaning you take one pill and it lasts 24 hours. The doses also have a wide range. While 150 to 300 is the typical range most people are on, doses can go from 75 to as high as 522. A person might want to be on IR instead of SR or XR if they're using Wellbutrin as a smoking aid. Another person may want to use XR because it's more convenient for them to take one pill a day. Another person might want to do SR if they feel as if the XR is releasing too slowly. Next. A lot of people may think, well, weaning off one med to start another takes a lot of time and effort. Well, in that case, I have good news. You don't have to wean off your other meds. Next. Wellbutrin basically acts as a sidekick to the SSRI or other medication. It gives the brain a better chance of fighting depression. This works because you're taking multiple drugs that go through multiple different pathways. For example, an SSRI goes through serotonin, whereas NDRIs, such as Wellbutrin, go through the norepinephrine and dopamine. So multiple parts of your brain are being stimulated. This also means there is a reduction of side effects from the other medications since they kind of contradict. Augmentation therapy is defined by Schweitzer as the addition of a second agent to an existing antidepressant regimen with the aim of achieving improved clinical response. Next. There are some common misconceptions people have about augmentation therapy. The first being that Wellbutrin plus another antidepressant could cause serotonin syndrome. This does not happen. The reason for this is because Wellbutrin affects only dopamine and norepinephrine. It doesn't even touch serotonin. There's also FDA approval. There is no FDA approval, therefore it is unsafe. Numerous clinical trials would disprove that, including the STAR-D trial, one of the most recognized augmentation therapy trials done on antidepressants. The FDA also didn't say it wasn't approved, and usually they don't go around marking every single interaction, every single combination of drugs a person can take. It would take up a lot of resources. Next. Augmentation therapy with bupropion can be safer than with other augmentation medications. For example, bupropion is safer than Abilify, but their uses are comparably the same. Compared to Abilify, Wellbutrin has a lower risk of rehospitalization. Unlike antipsychotics, Wellbutrin also has a significantly lower risk of movement disorders, which most atypical antidepressants can cause. Common antipsychotic symptoms are also not great, being weight gain, drowsiness/sedation, and tardive dyskinesia, which is a movement disorder that sometimes does not go away once you stop taking the medication affecting it. On the chart, you can see that the hazard risk for Wellbutrin is significantly lower than the hazard risk for Abilify. Next. So, what can you take away from this slideshow? Wellbutrin is safer than antipsychotics in augmentation therapy, beneficial to reducing side effects, and increases the chance of lessening side effects such as weight gain and drowsiness. So what next? You could post a YouTube video like me talking about how great this drug is after you try it. Or, next time a friend or family member goes to the doctor, help them advocate for themselves and advocate for the betterness of their treatment. Next to the bibliography, thank you. I did it.